I'm Dr. Jeff Rippetoe. If you are watching this video right now, there's a reasonable chance that you are seeing a doctor through Shawnee Health for the first time and are likely to be given a prescription for buprenorphine for treatment of opiate use disorder. If that's the case, let me encourage you at a later time to go watch a couple other videos that I've made that describe what happens to a person's body when they're addicted to opiates and also how buprenorphine works. I think those two videos will explain a lot about how you've been feeling over the past couple of years that have led you to seek treatment, and also for why this medication works so well for so many people. So in this video, what I hope is to explain to you exactly what's going to happen by joining our program. Now, when I say program, what do I mean by that? A lot of people will say, I'm in a drug treatment program, I'm in an addiction program, I'm in a program. That can mean a whole lot of different things. Here at Shawnee Health, essentially what that means is that you're going to see a healthcare provider every so often, and what that means changes a little bit over time, and be prescribed a medication. We may require you to go to counseling, we may not require you to go to counseling. Again, I'll talk about that a little bit later. But essentially, by you coming into the office today and seeking treatment with one of our Shawnee Healthcare providers, you are now in a program. Now, what do we call that program? We use a couple of different names. When our program first started back in 2011, we called it OBOT, O-B-O-T, Office-Based Opioid Treatment. We changed the name a couple of years ago just to, keep things fresh. We now call it SUD, the Substance Use Disorder Treatment Program. So you might hear the phrases OBOT or SUD thrown around. They're not made up words, I promise. The program, again, currently called the SUD program, or Substance Use Disorder Treatment Program, but sometimes we revert to old ways and use the phrase OBOT. So if you see those thrown around while you're in an office at Shawnee Healthcare, that's what we're talking about. Here at Shawnee Healthcare, we've been treating opiate addiction with medications going back to 2011, when Dr. Aaron Newcomb and I jointly started a program to treat people addicted to opiates with buprenorphine. Since that time, our program has expanded, and we're now offering treatment in Carterville, in Marion, in Carbondale, and in Murfreesboro, where I practice. So first of all, welcome. We hope that we can help you. The best part about joining a program through Shawnee Healthcare is that we hope to help you conquer your problem with addiction. Easily the best part. And again, if you haven't watched the video explaining how buprenorphine works, I encourage you to do that because your odds are good. Here's the worst part. You gotta sign a whole lot of paperwork, and that's a good chunk of what we're gonna do at your very first visit to get enrolled in this program. There's reasons for all the paperwork. Firstly, we really want you, the patient, to understand what you're getting into and what our expectations are when you enroll in this program. Secondly, there's a whole lot of legal issues surrounding this. In order for a healthcare provider to be able to prescribe buprenorphine, they have to get a special license. I had to get a special license, Dr. Newcomb in Carbondale had to get a special license, Laura Castillo, nurse practitioner in Murfreesboro, and all other healthcare providers who prescribe buprenorphine have to get special permission from the DEA, from the Drug Enforcement Agency, saying that we will run a proper drug treatment program and do certain things in order to be accredited and not lose our license. So we have to jump through some hoops, to be honest, and you have to sign agreeing to jump through some of those hoops. Another important issue in this program is privacy. According to legal terms, we are treating you under some strict privacy laws that are even stricter than the ones encompassed in HIPAA. HIPAA, H-I-P-A-A, is a privacy law that was enacted, I don't know when, a while ago, but basically that protects patients to make sure that we healthcare providers aren't just giving away your healthcare information willy-nilly. We, in order to have you in our program, are going to need your permission in order to be able to talk to a couple of other entities that are going to help in providing your healthcare. Some of these are obvious, like I said. We need permission to talk to your pharmacy. We need permission to talk to your insurance company so we can bill them for any services. We need permission to talk to our labs so that we can order any labs on you that we deem necessary. There's some other things that we're going to ask your permission for that are optional, but that we hope that you will. In many cases, someone who comes to see me or any one of the other Shawnee Healthcare providers for treatment of substance use disorder is also now going to use us for their primary care provider, meaning we may treat other conditions not related to the opiate use disorder or substance use disorder. In that case, we need permission to talk to specialists or to the hospital in case you wind up there and need care with somebody else. As an example, I may see a patient who I'm treating with buprenorphine for substance use disorder, but who needs to see a kidney specialist for a kidney problem. I need that person to sign a form that gives me permission to talk to that specialist, or I'm not allowed to talk to them. And again, that makes providing healthcare more difficult. So a request of most people who enter into my program or in any program in Shawnee Healthcare that you allow us permission to speak with specialists. One that frequently comes up in the substance use disorder treatment program is hepatitis C. Unfortunately, a chunk of people who enroll in our program have hepatitis C from previous intravenous drug use, and we have to coordinate that care with specialists. And again, we need your permission to do that. So, for all patients out there enrolling in the substance use disorder treatment program, please review the form and consider giving us permission to speak with other healthcare providers. I promise that we are not flippant with your information, and we really only discuss with other providers what is necessary to give you the best of care. An important consideration there also is that buprenorphine, which you are probably going to be prescribed, has some very special qualities to it that also, unfortunately, a lot of other doctors don't necessarily understand. I've had a lot of patients go to the ER and have had some difficulty there because maybe the emergency department provider doesn't understand all the nuances of buprenorphine. As I said before, there's a lot of rules and regulations, and those get misunderstood. There's some special chemical properties to it that means that it interacts with different drugs in different ways. It's really nice if the emergency room physician or if any other specialist can call and you've given us permission to speak with them. So that part's important, and please note that part on the form and consider signing that. Another optional part on the form is whether you will give us permission to speak with any family members or friends. This is totally optional and up to you and to your individual situation. If you have a spouse, boyfriend, girlfriend, sibling, parent, child who you would like to be able to view your health information, that is an option on the form. Here's what you really need to know about that and some practical considerations. If you, for example, can't pick up your prescription or need somebody else to call and arrange for your appointments and call to arrange transportation for you, we need permission to speak to that person. If you don't appoint somebody on your form who we can speak with and that person calls and asks us questions about you, we will deny knowing you. And I am not kidding when I say that. So if you, for example, need your sister to make arrangements for you to have an appointment or some transportation, and your sister calls and asks a question, but you haven't written specifically on this form that your sister has permission to do so, we are not going to give your sister any information whatsoever. So that's the upside to putting somebody on the form saying we can talk to them. Now the downside is that if you put somebody on that form, we are allowed to give them other information. You can kind of limit what information the person gives and what information the person gets from us. But again, please review that part of the form carefully because that is important. We do ask everybody who enrolls in the program for a verbal password. That is actually a federal requirement so that we can verify that the person we're speaking with is you. And that password can be absolutely anything you want to. And it sounds a little strange on the phone, but you may call and say, "Hello, I am John Doe, and I'd like to speak with the substance use disorder program's nurse because I have a couple of questions." When that nurse gets on the phone, they're going to verify who you are. They'll ask what your name is, what your birthday is, and they'll ask what your password is. So we're not going to use the password any other way, I promise. Again, it's just another way to verify that it's you, and we only change the password with your permission. Let's talk a little bit about the actual nuts and bolts of what's going to happen when you come to an appointment. So you're going to come in the front door, you're going to check in with our receptionist. For the vast majority of visits, we're going to ask that you go to the lab next and leave a urine sample. We're going to test that urine sample to see if there are any illegal drugs in your urine, or some legal drugs for that matter. But basically we test to make sure that you're being compliant with the program. Now, here's a little note about our urine drug test. It's really good and it's really hard to fool. Of course, we've had people who have done some things that they're ashamed of and have tried to hide that by bringing in someone else's urine or by trying to doctor their urine to make it show different results than they want it to show. It's not going to work. We measure the temperature very closely. We measure several other things that makes it almost impossible to fool our drug test. We can actually tell on our drug test if you are taking the medication we prescribe you regularly as it is prescribed, and what other substances you've taken, roughly in what quantities, and how often you're doing those things. We do not kick people out of our program for relapsing. Let me say that again. If you relapse on our program, if you are doing well on buprenorphine for a little while and slip up, use a substance that you're trying to avoid, that is not something that's going to get you kicked out of the program. Please be honest when that happens so we can figure out what caused you to have the relapse and we can work towards making sure that it doesn't happen again. Most providers, me included, much prefer to hear from you before we see it in the urine test results if you've had a slip up so we can talk about what's behind that. I never like it when somebody tells me they're doing perfectly well, but then I get their urine results back a couple of days after they were in the office and it shows that they've been using several different substances. Again, honesty, key to getting clean. But back to the nuts and bolts. When you first show up at the office, again, you're going to check in with a registration at the front. Usually somebody's going to take you back to the lab to leave a urine sample, and there's a procedure there. You'll figure that out after the first couple of visits. Not too complicated. And after that, the nurse is going to take you to an exam room where you'll then have a typical doctor's visit. We use electronic prescribing through Shawnee Health, which means that you don't get a piece of paper with a prescription written on it. We send all prescriptions directly through the computer to the pharmacy. So if you're on either Subutex, Suboxone, or generic buprenorphine, that's how your prescriptions will be handled, directly by sending refills to the pharmacy. If you're on Sublocade, the injection form, you'll get the injection in the office, and we'll take care of that through your insurance at a separate time. Meaning you won't have to pick up the Sublocade beforehand. It should be waiting for you at the office when you get there. When you leave the office every time, it's important that you make a follow-up visit. If you don't do that, we can't guarantee that you'll necessarily have an appointment and be able to get refills of your medication on time. Unfortunately, there is a high demand for buprenorphine, and all the providers through Shawnee Health who are prescribing this drug have a little bit of a wait to get an appointment with them. So if you don't make an appointment when you leave and call the day that you have run out of medication, there is some possibility that we won't be able to give you a refill, because we may be required to see you in the office to give you a refill. We may not get the message in a timely fashion. All sorts of things can happen. But again, when you leave the office every single time, it is important that you make an appointment so you know when the next time you are coming into the office is. Most providers through Shawnee Health will give you a prescription for the buprenorphine that is going to last just until your next appointment. Meaning, if you are going to come and see me in 28 days, I'm going to give you a prescription that's going to last you just 28 days. How often you have to come in kind of depends on how well you do in the program. Somebody who is struggling to stay clean, having some issues with anxiety, depression, generally not doing well, may be required to come in as often as once a week for a check-in. And that's for us to make sure, first of all, that you're physically okay, but also to see if there's any other services or help that we need to offer. People that do really well, meaning that their urine drug screens show no illicit substances, have been compliant with the program, and are doing well, may be required to come in only once every 2 to 3 months. And again, how long you have to go between your appointments depends on mostly how you do and what your provider's sense is of how you've done in the program. Usually, at the start of the program, we'll require you to come in every week for a period of time over the course of a month or two. Then if you're doing well, we'll space visits out to every 2 weeks, then to maybe every month, and if you're doing really well, then to every 2 months to 3 months. Before I'll allow people to go 3 months between appointments, typically I require multiple urine drug screens in a row that look good, and my trust that a person has been doing well, and me just generally having a sense that they're doing fine and don't really need anything out of me except for a refill. So here's a couple of things not to do in our program. Do not change your own dosage of medication. If you're coming to see a provider through Shawnee Health for buprenorphine, that means that you've had an issue with taking a substance that probably wasn't prescribed to you in an amount larger than you intended to take for a longer period of time than you intended to take it. Here's what that means. You may have some issues with wanting to take more medication than is actually prescribed to you. We're not too forgiving with this, by which I mean if you run out of buprenorphine prior to your due date for a refill, we're not going to give you an early refill because we don't want to condone that type of behavior. If you're struggling with drug cravings or struggling with something else that's making you want to take more of the medication than is being prescribed, you really need to come into the office and talk to us about that. Don't do this. This happens a lot. Someone will call 3 to 4 days before they're due for a refill and say, hey, I ran out a little bit early. Can I get a refill? The answer is probably going to be no, because again, we're doing our best to try to keep you on the straight and narrow and to avoid that kind of behavior. One thing people regularly fear is getting kicked out, so to speak, of the program. It's possible. Now, the difference in practice from one provider to another through Shawnee Health is quite a bit. So I'll just tell you about what will get you kicked out of my program specifically. There are really only a couple of things. If I figure out that you have doctored a urine test in any way, in other words, you've brought in somebody else's urine or you've manipulated your urine in some way, I will automatically dismiss you from my program. That is dishonest, and honestly, it leaves me in a low level of trust in a person, and it makes it hard to treat somebody who you don't trust. So that's an automatic. If I find out somebody is selling their medication, it's hard to continue to justify to prescribe the medication, because then the DEA views me as enabling a drug dealer, and I'm not really interested in that. So those are the two that, bar none, no question, can get you dismissed from our drug treatment program. Let me reiterate once again, relapses will not get you dismissed. All of us who prescribe buprenorphine through Shawnee Healthcare do this because we want to help people beat their addiction. And we know that that's difficult and that there might be slip-ups along the way. So again, just talk to us about those. Don't try to hide them. We would rather hear about it from you than figuring it out through a urine test result. In terms of dosing of the medication, every single person gets an individualized treatment plan. Now that's fancy talk for we doctors and nurse practitioners are basically making this up as we go. We'll ask you about your past drug usage and kind of make a judgment on how much buprenorphine we think that you're going to need. To be honest, sometimes I guess right, sometimes I guess wrong. Your job is to tell me how you're feeling and to allow me to use that information to make a judgment on whether we need to change your dose or recommend any other sort of treatment. Sometimes I get the dose right the first time, sometimes I don't. Again, tell me how you're feeling and we'll come to a decision together about whether your dosage needs to be increased or decreased. If you've never taken buprenorphine before, it is a unique type of medication in that it is not a pill that gets swallowed like a good chunk of other medications. It comes in either a pill form or in a film form that gets placed under your tongue and it dissolves. If you haven't ever taken it, I do recommend you review with your pharmacy the proper dosing of this to make sure that you're getting it in the right way and not having any problems with it. There are some times that we will require a person to go on Sublocade in order to remain in our program. Sublocade, if you don't know what that is an injection form of buprenorphine in which a person only has to get an injection once a month. I covered details on this in one of my other videos. Review that if you need to. There may be cases where a person in our substance use disorder program may be required to go on the Sublocade injection in order to remain in our program. Sublocade is an injection form of buprenorphine that's only taken once a month in the office. Some instances in which we healthcare providers may require a person to go on this are if the person is not taking the buprenorphine as prescribed or having a hard time with this, if the provider is worried that the person may be diverting, meaning giving other people their medication, or if somebody is continuing to abuse other illicit substances like methamphetamine. Now, we have our reasons for doing this. It's a little bit irresponsible of a healthcare provider to give someone a prescription for a controlled substance like buprenorphine if we know that that person is heavily abusing other controlled substances like methamphetamine or cocaine or other opiates or what have you. So I can't control everything that somebody in my program comes and does, meaning when I give you a prescription and you head out the door, I can't totally control what's happening with that prescription. If I have concerns that you're not controlling it well, I can change that a little bit by saying, I really think you need to go on the Sublocade because that's more controlled. At least then I know exactly what dosage of the medication you're getting, how often, and that it's regular. So if I feel like somebody needs a little bit of higher level of my control, I may require that. And most of the other healthcare providers through Shawnee who are providing buprenorphine are moving that way also. You may have questions about the cost of this program. At Shawnee Healthcare, we accept essentially all forms of insurance. So you may have a copay relating to each visit to see your healthcare provider. You may not. That depends individually on your insurance. Even if you don't have insurance, we have a sliding fee and work very hard to make that affordable for people. If cost is an issue in the program, please discuss that with your provider. Most of us have gotten pretty savvy over the years at keeping people's costs down. The medication cost can range from almost nothing to quite expensive depending on what your insurance situation is. Again, I can't go into details of everybody's insurance situation, but just let us know if you are having problems affording the medication, and we can typically give some tips or tricks on how to make it more affordable for you. For a long time, the gold standard in the treatment of substance use disorder was counseling, and that is still an important part of treatment for some people. Now, we don't here at Shawnee Healthcare necessarily require that every single person who's prescribed buprenorphine or who's involved in our substance use disorder program to go to counseling. This is an individualized decision, which means that your healthcare provider may or may not decide that they think counseling is necessary for you. Now, we can, as your healthcare provider, potentially require a person to go to counseling in order to continue to receive prescriptions for buprenorphine. And there are cases where this might happen. For example, if somebody is really struggling with their addiction and continuing to use illicit substances in spite of being on the program for a while. There are other cases where a person may be struggling with depression or anxiety, and that's feeding into their addiction, and the provider feels that that person needs counseling in order to improve those symptoms and have a better chance at beating their addiction. We have excellent resources here at Shawnee Healthcare for counseling. I highly recommend that if you're interested in that at all, in counseling in other words at all, that you speak with your healthcare provider and see what resources we have to offer to you. We have a few counselors in particular who have some specialized training for treatment of substance use disorder. Now that doesn't just include opiates, but benzodiazepines, cocaine, alcohol, or any addiction that you may have. And on a personal note, they're quite excellent and lovely people. So if you're interested in that at all, please let your healthcare provider know. If you're hoping to seek counseling through a different agency, including in some cases in which it may be court ordered that you go through a different agency, that's also acceptable. Just try to keep your healthcare provider aware of what you're doing in counseling. There are times that you may be required to go to counseling for, say, DCFS or for court cases where there is some required communication between your healthcare provider and your counselor. To go back a little bit in the video again, let me just encourage you to make sure and sign that part of the waiver that gives your healthcare provider permission to speak with your counselor in order to coordinate your care as best as we can. A couple of specific issues that come up in our program sometimes. If a person has some legal issues relating to their drug use, or if they're involved with DCFS and that case stemmed from their drug use, the court may ask that person permission to speak with their healthcare provider about that person's case. I don't have specific advice on this, honestly. If you have one of these situations, in other words, DCFS is involved in your life, or you have a court case that's pending, you may or may not seek to give your healthcare provider permission to speak with the court or with the DCFS caseworker. Again, put more simply, you can tell me that I can talk to DCFS or that I can't talk to DCFS. You can tell me that I can talk to the court or that I can't talk to the court. Now, obviously, if you tell the court that you don't want them talking to me, that sends a certain message. Ditto for DCFS. You do need to know this though. If you give permission for your healthcare provider to speak to DCFS, a lot of times that means that DCFS or the court will have access to a chunk of your medical records, which includes some lab results possibility, and especially the urine drug screen results. Now, this can be beneficial to your case if you've generally done well and your urine drug screens aren't showing any illicit substances. If you've struggled to stay away from illicit drugs and your urine drug screens are continuously showing illicit substances in them, obviously it's probably going to be more beneficial to you to not give permission to your healthcare provider to speak with the court system or with DCFS. So again, this is an individual decision that you can make. Now, we don't permit at Shawnee Healthcare that you tell us that we're allowed to give only partial information to DCFS or to a court. It's just dishonest. If you give me permission to speak with DCFS or with the court system, I'm going to require that you give me permission to talk about either everything or nothing. Now, let me say this also on a personal note. One of the greatest joys of writing buprenorphine for people who have turned their lives around is writing glowing letters to judges and DCF caseworkers saying that, yes, this person had a problem with addiction, but they are now free and clear of their addiction and their life is better, and I think that they are responsible and capable of driving when their license was suspended, of taking care of their kids when DCFS removed them, or of having these charges reduced or dropped because this drug addiction is no longer an issue for them. So if you want me to write you a nice letter of recommendation, I'm happy to do that if you've merited it. When you come in for your first visit with one of our Shawnee Healthcare providers, in order to be enrolled in the substance use disorder treatment program, we're going to request a blood test of you. Now, let me say this, we don't absolutely require this in order to be a part of the program, but it's a good idea. We really want to check a few fairly basic things. We want to make sure your blood counts are okay. We want to make sure that your liver and kidneys function like they should. We want to make sure that you don't have hepatitis C, and we want to make sure that you don't have HIV. And ladies, we want to know if you're pregnant, because that lends some special considerations to treatment. As a matter of fact, I'm doing a different video that addresses specific considerations for opiate use disorder in women who are pregnant and how that treatment looks a little bit different. So if you have questions about that, you can check out that other video. But just know that those blood tests can be used to guide and change treatment a little bit, and to maybe find some other conditions that you might require health care for. So again, please give us your blood. We're going to check it for all the right reasons so we can intervene if you do have any other health issues. All right, so I know very well that this video has been maybe a little bit boring. There's a whole lot of bureaucratic stuff in there. Again, we, your healthcare providers, have to be compliant with the law by giving you all this information, by making sure that you're signing all the appropriate forms. And again, we want you to know what you're getting yourself into with this treatment program. Sobriety is not easy. It's going to require some work on your part, and it's going to require coming in for regular appointments, signing paperwork that maybe you don't want to sign, and jumping through some hoops. That's the downside. Here's the upside. By the fact that you have come to see one of our providers through Shawnee Health and hopefully getting a prescription for buprenorphine in one form or another, you are doing the single best thing you can do for yourself to give better odds at getting away from illegal drugs. We hope to help you with that. So just know that we're here and we really do want to help. Nobody starts to prescribe buprenorphine for the money, for the power, for the glory, right? That's not why any of us get into this at all. We get into this because we honestly want to help try to make your life better. So again, be honest, let us know what's going on with you, and as always, don't be afraid to ask us any questions.